We can't make the nerves grow back like we can probably fix the blood supply, but you're now being aware of the problem with the fact that your nerves are damaged.
Right.
Should help you to do the right things in terms of avoiding these problems.
The involvement of the patient is what's really critical. With controlling diabetes, it's really a minute-to-minute, hour-by-hour, every day kind of a thing.
You're with yourself 24 hours a day. The doctor isn't. The diabetes educator isn't. But they have a whole lot of information that they can share with you that you can keep with you for 24 hours.
Doctors don't take care of diabetes. I tell patients all the time, you know, at best, I'm a coach.
Hi, Chrissy. How are you doing today? Good.
Besides acting as a source of information, diabetes educator Camille Isler sees herself filling a slightly different role for her patients.
We're their cheerleaders, we're their advocates.
Instead of insisting on dramatic and sudden lifestyle changes, Camille encourages her patients to make healthier eating choices that may include smaller portions and to get more exercise, which can mean something as simple as parking a few rows further away from the entrance to the grocery store.
I mean, it's real important to make the small changes and make them feel successful.
Again, it brings up these menus. So for your bolus and your basal, and then all the different things that it does. So let me let you just take a look at that.
But she also refuses to sugarcoat the serious consequences that patients may experience for failing to stay on top of their disease.
There are some bad things that go along with diabetes if blood sugars are not well controlled.
Dr. Buse says that one of the most vital tasks for patients in managing their diabetes involves regular blood glucose monitoring.
You can't fix the blood sugar unless you know what it is.
In addition to checking their blood glucose levels during the day, individuals with diabetes should have a hemoglobin A1C test performed. This test provides a picture of their average glucose control for the past 2 to 3 months.
It's been shown that hemoglobin A1C is the best predictor of the risk of developing complications.
Robert Pluscoda can vividly recall periods years ago when he let his diabetes get out of control.
Your sugar's going up and you're getting worse and you don't even know it. You're just getting tired, you sleep a lot, you don't have energy to do anything. You eat too much. Right after a meal, you get exhausted. You don't want to go anywhere to do anything. And it's the diabetes getting worse and worse and worse and worse.
Now that he is paying attention to his diabetes and has educated himself about the disease, Robert is making wiser nutritional choices and exercising more. He says the benefits are unmistakable.
I've made some improvements. And to where I'm at now, I'm getting better every day, and for the first time in my life, I feel really happy with myself, and I don't fear the diabetes anymore. I control it.
These days, Dr. Buse says he's hearing more success stories like Robert Pluscoda's and fewer nightmares involving diabetes-related complications.
10 years ago, it was common. You know, every week, every month, I would hear about somebody going blind or having an amputation. I would see someone as a referral from the community that was just a wreck. That pretty much doesn't happen anymore. So I think things are really getting a lot better very quickly in the United States. I think the statistics are still a little bit behind.
But experts like Dr. Judith Fradkin at the National Institutes of Health emphasize that there is still plenty of room for improvement.
Research has shown that only 7% of people in the U.S. are actually achieving the level of blood sugar control, blood pressure control, and cholesterol control that's already been conclusively proven to reduce their risk of complications. We know that we can do much better than we are doing.
Coming up, we'll see what a looming obesity epidemic may mean for the future of diabetes.